Welcome back to Apple Worldwide. My name is Mamle Yuko Godwins and I'm a psychiatric nurse practitioner. I talk mainly about trauma-related topics. We talk about mental health-related topics. We focus about children because children are so important to me. The foundation we give to our children is what sticks with them. It's what they grow up with. It's what makes them to become or not to become. So the question today is, would you accept a system to diagnose your child with a developmental delay, a special need? Secondly, what kind of special need are they diagnosing your child with? Is your child a first child? Is your child exposed to other kids? Is your child home with you? Is your child having an environment where the child gets stimulated to achieve or not? What are the issues that causes people to be diagnosed by a school system? Every child have they have milestones. They have to talk at certain time. They have to crawl at certain time. They have to walk at certain time. Are they meeting these milestones? Are they not? These are some of the things that they look at to say, oh, your child have a special need, your child have a delayed speech, your child have a learning disability, your child have this, your child have that. So when they perceive that the child is not meeting some of these milestones, they start investigation process. The investigation means they start referring the child to certain providers, like a special educator who comes in and evaluate the patient, your child. They get a person who has expertise like learning disabilities. The child having ADHD, they have assessment tools that they use to evaluate your child. These assessments have to be done in different settings by the child's parents, in their home, in their school, in different settings. So it has to happen in 2 or more settings most of the time. If the child have these behaviors in setting more than one setting, then they consider that the child have these issues. Let's put it this way. Does your child have ADHD, which is attention deficit hyperactive disorder? Or does your child have autism? Or, it comes on the spectrum, which can be high functioning or low functioning autism. Does your child have behavior disorders? Does your child have cerebral palsy? Does your child have cleft palate? Or cystic fibrosis, Down syndrome, fetal alcohol syndrome? What kind of disorder are they diagnosing your child with that will cause your child to have this special need education, specialized education? You have to always find out, and you don't have to always rely on the school system for you to say, okay, I agree. Whenever the school system come up with something like that, always make sure you talk to the child's pediatrician, you talk to a family doctor who will also do other further assessment, give you referral to like a neuroscientist, a pediatric neuroscientist or developmental specialist in those areas that they are stating that or trying to label your child. This helps you to have a definitive diagnosis for your child, and that will also help you to be more informed as to what services you should be allowing your child to be given. That is one. So these illnesses or these developmental diseases or disorders or these are neurological disorders most of the time that your child has, and as a result it can affect your child having maybe dyslexia, intellectual disability, language deficits, things like that. Because when these kids have these illnesses, it prevents them to meet their milestones on time. They will be delayed in a lot of areas. So this is for the child that truly have a need, that needs help. Okay, now let's talk about the child that is being labeled as a speech delay, as a child who is maybe deprived to have exposure. Example, as an African, and as somebody that has been a victim of these issues, what I paid attention is, in most instances with us Africans, when we have our first child, we are in America or Europe or wherever alone. We don't know anybody. We don't have family and friends around. It's either you and the child in the home alone. And the child is probably not being introduced to activities. You're not reading to the child. You're not talking to the child. You just get up and do everything for the child. You play with the child, but you are not communicating in a way that will stimulate the child. These are some issues that can cause your child to be delayed in talking. Not necessarily because the child has an impairment. In this instance, most of the time, a school system will try to label your child and give your child IEP. Great. If they're giving your child IEP, you have to understand that the child is going to have a lot of limitations. They are not going to teach your child based on what every other child is being taught. They are going to limit your child. They are going to give your child substandard education. They are going to program your child around their interest. Let's say you have a child that is autistic. If the child interest, autistic kids, we have something called stereotypic. So when the child is autistic, they have interest in stereotypic activities. Maybe they like to arrange things. They like to draw. They like to write. So even though they are autistic, they may be drawing a certain pattern as their way of writing. You know, autistic kids have social and language impairment, heavily impaired in the language arena, but some of them can draw. So as the child is drawing, they pay attention, they realize this child likes drawing. All the child's education is going to focus around drawing. They are going to design the child's education and activities related to the child's learning around drawing. Is that what you want for a typical child that is not really autistic, but is just not talking because he lacked the right exposure? Some parents have been faced with the instance where, should I take my child to Africa? Should I not? I will tell you, most of the time, such children that don't really have a true impairment and don't need to be put on these special education programs, when you move them out of this system and put them in Africa have crèche. Most of the kids start crèche at the age of 2 months or 6 weeks, or so the parents can go to work, or 3 months. If you move a child that is 2 years, 3 years out of America, out of UK, out of wherever, and you put them in Africa, a child that don't have true impairment, within 2 months, 3 months, I promise you that child will start talking. Because the child is now all of a sudden exposed to people, aunties, uncles, stimulation. People are running, he's following the people. He has now been exposed to an educational system that is not labeling them, but is treating all of them as equal and teach them equally. Other kids are talking, other kids are eating. Now the child starts to imitate after them. Within 2-3 months, that child starts talking excellently with no issue. If you can afford that, you have that luxury, you have a good system in place, like a family, school, somebody that can take your child. I would not say that you should keep your child in America. I am definitely going to be that parent or that advocate or that healthcare provider that would suggest to you, take your child to Africa. If you take the child to Africa 2 months, 3 months, and you put the child in an environment where they have good structure in place, the child is getting up every morning, prepared, dressed up, gone to the program, school. That's what I mean, structured environment. They are learning the ABCDs, they are learning the 2-letter words, they are writing. He's seeing all these other kids doing these things. Within a short period of time, you see your child doing marvelously, and you realize it would have been the worst decision for you to allow the school system in America or wherever to put the IEP on your child. This is also an instance where the child doesn't have true need. Okay, let me tell you some downsides of IEP. IEPs, they set low standard. Substandard education is provided to your child. The expectation given to your child that is otherwise normal and can achieve their highest potential, the child is suppressed, the child is limited, the child is not pushed, the child is given benefit of the doubt, and the child is limited. So it sets low expectations and misrepresents the child's educational potential. 2, does IEPs or special education, special individualized special education, does not target the fundamental cognitive, communication, behavior, sensory integrative, and social deficits of autism spectrum disorder children. Do you see the amount of harm you could be doing to your child when he or she does not have the true diagnosis that they are saying? If you allow your child to be diagnosed as autistic, specifically, the research is saying that specialized education for your child, it limits your child, and it does not target the fundamental cognitive, communicative, behavior, sensory integrative, and social deficits needs. Because the child, if it's autistic, they lack this potential, they lack these skills, they are limited cognitively, they are limited communication wise. They can't communicate like everybody else. Most autistic kids that are on the low spectrum cannot do a lot of these things. They are limited in their way of thinking, their way of functioning, their way of doing calculation, their way of reading, their way of writing. They may be 20 years old and can be functioning like a 2-year-old. You understand? It's up to you, the parent. At the end of the day, it's the parent's investment that counts. So if you allow your child to be diagnosed and everybody else relax and not pushing your child, how does it affect the child at the end of the day? You are going to be all your lifetime being taking care of somebody that in reality shouldn't have been diagnosed or labeled that way and become a burden on you. Another point, IEP does not capitalize on characteristics, strengths of this population. IEPs, when your child have special education, they don't force the child to reach their maximum potential. So what I'm trying to communicate here is that do not sit and get your child misdiagnosed without you yourself taking extra steps to get the child to see specialists that will help your child get the right diagnosis. So one, we know that some of the issues that can get your child to have delayed speech, delayed milestones, is the lack of stimulation. So if you are not exposing the child to in environment, you have a child, and because of childcare, that's one reason. Childcare is expensive. A child, a baby, 2-month-old that you are trying to return to work. In America, you're paying like $300 a week, $350 a week for childcare if you want to take the child. So on the other side, most parents will not want to pay that. So you are stuck at home running shift with your husband. You work day shift. Your husband is home during the day. You work evening shift. Your husband is home in the evening, and the child just know you two, and is now stimulated by activities or 2-year-olds like himself. So he can be talking, running after each other, playing, parallel playing, and getting to push him to reach milestones as expected. They may be walking, they may be eating, but they may lack speech. Okay, another issue is when you got that child in the hospital, have you checked under the child's tongue? Have you checked behind their butt? Do they have any sac on the buttocks? Those are the things that can cause you to know if your child is going to be able to walk, is going to be able to talk. If there's a cord under their tongue, that affects the ability of their tongue to move up and down, move side to side. Have you addressed that? So if the child have these things, the child is definitely going to have some kind of developmental milestone deficit, or developmental disability, or developmental illnesses like spinal bifida, cystic fibrosis, things like that. Does your child truly have impairments, or does your child have pseudo impairment, meaning false impairment? Means the child just didn't get the exposure they need to be able to get stimulated and talk and do things according to their age appropriate milestones. That's the difference. So as a parent, it is the responsibility lays heavily on you to make sure you are taking extra steps to get extra investigative studies done. See the specialist that will give your child true diagnosis to find out, does he truly have this impairment, or is just that a delay that needs extra money investment? You need to invest your money and your time to get services that to help the child, or you just sell your child cheap to the school systems to be labeled with all these tags, and then the school benefits. When a child have IEP, the benefits is it helps the school system because they get heavily funded. The government gives one child a huge amount of money to provide speech services, special education services, occupational therapists to help the child if they don't eat, if they can't feed themselves, if they are not potty trained, if all those things. They need special education, occupational therapists, speech therapists, sometimes physical therapists in terms of a child that have a spinal bifida, cerebral palsy, and things like that. You understand? So I'm here to tell you that sometimes taking your child to Africa just to try out for a month or two is not a bad idea. If the child goes there and then you realize, oh, it is the change of it, it is the environment that is limiting the child, then you keep the child there for another a year or something. You come back, work, find somebody, take care of your child, and then eventually after a year or two, when the child starts talking, you bring them back, and shoom, you see everything will be perfect. Those tags will be taken off the child, and those limitations will not be there anymore. In America, it is stated that we have 12 million people that are misdiagnosed a year. 12 million people get misdiagnosed a year. Guess what? 40 to 80,000 people die out of complications of this diagnosis. Some of these kids grow up to become depressed, have substance use disorders, become drug addicts, they end up in the system. They become defiant because they, and guess what? Minority are those that are mostly faced with this kind of misdiagnosis. Boys get misdiagnosed a lot, but research has shown that black boys, males, boys of color get misdiagnosed majority of the time. So now the question is, you and I as parents, what would you do? And I've said some of the things. There are benefits of IEP, individualized education, specialized education. Your child get the right help if they truly have a need for it. The school get heavily funded by the government, and so they will push your child with their last breath on labels, so they get funded for they get funds from the government for the school. You as a parent, the good thing is you're going to have a child that have help to meet certain milestones. On the downside, you as a parent who is also accepting this tasks and special needs for your child who doesn't have it, ends up being on the low end. It affects their education, it affects their future, it affects the kind of jobs they get, it affects the kind of colleges they go. I'm encouraging you as a parent watching me to wise up, take the necessary steps, make the necessary investments. The right investments can even land your child with scholarships that you will not have to pay thousands and thousands and thousands of dollars for college education. The foundation goes a long way. Parental involvement goes a long way. The school system is not the parent of the children. The school system don't have the burden of what the child becomes. You, the parent. The child becomes great, it's on you. The child becomes bad, the stigma lays on you. Mental health is something that we as people of color lacks the information we need to seek the right help. But my focus here is to help you get the right help for the right need, not the help you don't need for the wrong need. I'm here as your advocate, as your mental health nurse educator, and as a person that has walked these walks, and the person that has gotten education and became more informed, and that is here to give you the awareness desired. Thank you for being here, and I encourage you to subscribe to this channel, like my videos for me, share them with family and friends, and let us continue sharing and learning. If you are new, don't forget to like it. Don't forget to watch my other videos and get more information on parental alienation. Once again, I am Epa Worldwide, and my real name is Mamle Yoko Godways. See you